has forbidden topics. If I would say more clearly, most of them are hidden famous secrets. Abortion is also such kind of a thing. Recent sudden drastic turns in this topic, which happened in some other countries, encourage us to have a look back on Sri Lankan context on this topic. You might be wondering whether abortion is legal or even moral. What is abortion? Why does this get happen? Therefore, to guide all of you, as 𝑄𝐿𝐿𝐿𝑜s, we thought of discussing about abortion and its related matters as our first Detect and Correct interview series regarding 𝙊𝙧 year 2022-23. So as to make our discussion series easily accessible for you, we are linking through two platforms, YouTube and official newsletter, which is in written form. As I said earlier, abortion is a wide topic, which requires to be discussed with a well-versed and experienced person's personal intellects. So with this vision, today we have with us an expert in the field of community medicine. Welcome, Dr. Nayana Shiranthi Fernando, a senior lecturer from Faculty of Medicine from General Sir John Kothawala Defence University. Ma'am, you are warmly welcome to Detect and Correct.
Thank you.
So before moving to our conversation, ma'am, I would like to know from you how your journey proceeded up to now as a doctor, a lecturer, and even as a humble, great personality.
So as a doctor, I love to be a doctor, and I like to work as a doctor to treat patients and treat communities and meet people. I think that is one of the greatest professions in the world. Then apart from that, being a teacher is another great profession. Then I think I'm doing both. So I'm very happy about my profession.
Okay, ma'am. Thank you for the great introduction of yourself. And let's move in the first question of today's discussion. As a well-experienced person in this area, ma'am, could you please give us a brief introduction of brief understanding of what abortion is and the insights about the current legal approach and actual practice in Sri Lanka regarding abortion?
Okay, abortion by definition is the forceful expulsion of the fetus from the woman's womb, the form, but there are scientific definitions. Then it can be safe. There are safe abortions and unsafe abortions. Those deliberate expulsions. Most of the time, unsafe abortion is the one that people opt for, because in most part of the world, people don't have access for safe abortion. Maybe legally and maybe due to economical reasons. And when it comes to the context of Sri Lanka, there are no correct figures about the rate of abortion, the number of abortions, but sometimes back about 2 decades ago, a community professor has done a research on abortion, and she adopted a very good methodology to look at this problem anonymously and without telling anything. They just examined women, and they found that like every day there were like 600 abortions take place in Sri Lanka. So you can judge the gravity. Every day we get like 1,000 live births. For that 1,000 lives, there are like 600 abortions. So you can see the gravity of the problem. And these abortions, most of the time, you think that it is due to unsafe sexual practices among young people. But it is not so. It's due, most of the time, the woman gets pregnant by her own husband, and sometimes they consider abortion as the way of contraception. That is the problem. And in most of the time in Sri Lanka, our system has failed in many instances where seek our help where people cannot get help from our system.
Thank you very much.
Yeah, do you need any risk factors or anything about abortions, the factors that can lead them go for abortions?
It's okay, ma'am. Continue, ma'am.
Okay, and so I said one thing about they become pregnant with their own husband, that is due to contraceptive failure. Contraceptive failure means it's not solely about the contraceptive method, but they won't seek contraception. They won't seek family planning methods from our health system. And health system also failed in approaching these people who need contraception. There are problems in either side. Then there are instances where unsafe sexual practices among people, unmarried people, and sometimes due to the social stigma and due to the girls who want to continue their education and they don't want to continue their pregnancy. And there are instances where a girl got raped by somebody. Those are the factors that lead to abortions. And underlying factors in abortions, those are the immediate factors, and underlying factors most of the time due to uneducation. There are poor awareness about contraception and safe sexual practices, and also the poverty.
Thank you for the great explanatory answer, ma'am. As you mentioned, though abortion is not legally accepted in Sri Lanka,
yes,
except for certain exceptional incidents,
yeah,
but still we are aware of backstreet abortions and unsafe abortion practices, risking lives at least, as you mentioned, more than 100 lives per day.
Yeah.
So what do you think the reason for that much of high tendency in abortion in Sri Lanka, ma'am?
Reason for that much of abortions?
Yeah.
Yes. Okay, and I told you about many things, but one thing, the contraceptive failures, the practice of contraception and acceptance of contraception by families, by couples, legally married couples. And also the poor knowledge among people about safe sex practices, using condoms or using post-coital contraception and all. And sometimes they consider that now some young people are more aware about those post-coital contraception, and they use it, they overuse it, and that is also lead to unwanted pregnancies. Then, but that is one thing. And when it comes to demographic perspectives, you know, our girls attend their menarche at the age of 10 to 12 years. After that, it's obvious that they have sexual feelings. They love to have sex, and it's natural. And however, they want to continue their education and get married after that. So the mean age of marriage in Sri Lanka is like 25 to 26 years of age. So there is a big gap between menarche and the age of marriage. And we don't expect them to be virgins that long, like 13 years or 14 years. So they inevitably enjoy sex with their partners. So we can't avoid that. It's human nature and it's natural. And only thing we need to educate them. In that sense, because of a lot of cultural barriers and things like that, we were failed in educating them about safe sex practices. And also, abortion is legally prohibited in Sri Lanka, except in certain instances. in that situation, it's essential to educate young people, sexually active people about safe sex practices. And we failed in that aspect. So I do a lot of education programs in schools about these reproductive health issues. And most of the time when I talk about safe sex practices and all, even teachers get annoyed and they think it's not necessary to teach them. That would lead them to unnecessary safe sexual practices. But anyway, I think when it comes to nowadays exposure of young people to media and a lot of inputs from media and all, internet and pornography and everything. And there are a lot of places where they can interact freely, like, in Sri Lanka, you can find rooms available in everywhere. Even in a furthest place in Sri Lanka has rooms available. So we can't deny the fact that people go there for sexual practices. And so anyway, we have to educate them about safe sex. That's my point. So we can't deny the fact young people need sex. They love to do that, and they get married later in their life.
As a doctor,
they can't be virgins for that time. Okay.
Yeah. And is it because of the unawareness these kind of things happen?
Most of the time, unawareness.
Is this because of
unawareness? And even in my experience, I did research on young people who got sexually transmitted infections, and their knowledge on STDs are very low. And sometimes they are completely dumb about those issues. So that reflect their knowledge on safe sex practices.
Yeah, ma'am. As a doctor and a community consultant, there is no doubt that you might have probably encountered who wanted abortion and who opposed abortion. Hence, as an expert, what's your perspective on abortion? And also, doctor, can you please briefly mention us the complications of abortion? Are there any, and does it affect somebody's physical and mental well-being?
Yes. So when it comes to complications, as you said, there are physical consequences and mental consequences. Physical problems, the woman can get infections, that life-threatening infections. I have seen women dying of infections after abortion, very dangerous. And also they can get embolism, amniotic fluid embolism, which is a condition, life-threatening condition. And after the infection, sometimes they get infertility for the lifetime. Then there are other bleeding problems, and bleeding can lead to death. Then anemia and all. Then about uterine rupture and lot of complications, damage, injuries to the uterus, cervix and vagina. Then also when it comes to mental, psychological complications, they cannot escape from that guilty, and because of this, because of our cultural and religious backgrounds, people know that it's a crime and it's a sin. And there are social stigma whenever a woman being labeled as a woman who had undergone an abortion, she will be stigmatized by the society. So those are the consequences. Though the health consequences are more.
As you explained, ma'am, the unawareness of the communities among Sri Lanka paves way much more to abortion. And also, culture, religion, morality make boundaries on each and every action in society. Abortion is one such. So, being in a multicultural, religious country like Sri Lanka, do you think what is the social wave for? Is it pro-choice or pro-life? And do you think that we need a change in that? If so, could you please tell us why?
So it's a very difficult question, pro-choice or pro-life. I am a person for pro-life, but I think pro-choice has certain points, positive points, like for example, if a girl got pregnant while doing her degree and while doing her final, close to her profession, close to get into a profession, so that would completely ruin her future plans. So there are some points that we have to consider. But anyway, it's a life and we need to preserve lives. We in religion and in our culture, we always embrace children and kids, and we love to have kids, and we always love to preserve lives of people, even not people, even for insects and animals. Our religions and our cultures always want to preserve lives of others. So if a country goes to pro-life, if our legal system wants to if a country wants to make abortion illegal, then that country should have proper system to educate people, proper system to provide contraceptive methods, and proper way of reaching communities to provide those contraceptive methods. And if a country goes for pro-choice, like the legal system allow abortion for a certain extent, then the country should have safe places to get the abortion done with skilled professionals, skilled people, and necessary equipments and drugs. Otherwise, we can't promote pro-choice.
Change in just a social perspective doesn't make any change in the society. It needs the involvement of all the parties to engage in it and move forward. And doctor, do you think any change in the current law and any change in the idea of the expertise who is responsible in this?
Yes, I think the current law should be revised, giving more room for women's choices. And also, I don't think whether it can be done, because I'm not a lawyer, I'm a doctor. And when it comes to abortion, we have to consider each person's background and their choices and all. Then only we can accept that abortion is correct or not. In the legal system, I think there should be more room for abnormal fetuses like anencephaly and all. There are abnormalities detected during the in vitro life in the uterus. So those abnormalities should be included in the system as a indication for abortion.
There's a famous saying, yeah. There's a famous saying, prevention is better than cure. And preventing some root causes for abortion will be much better and healthier for for all before restricting or granting avenues to abortion for pregnant women. So we would like to hear your advice on how to prevent causes that cause and give rise to abortion, ma'am.
First thing, I think we need to empower girls and women about their life choices and when to have kids, when not to have kids, and how many kids she should have. Those empowerment include life skill education starting from grade 1. So not about reproductive education, but female empowerment starts from the grade 1. It should be included in the school curriculum. I think that would be the most effective way of overcoming this sort of problem in our country. Then providing services for them, like accessibility to contraceptive methods, accessibility to reproductive health education, accessibility to doctors, nurses, whenever they need help. Also, the legal system should cover girls' rights, women's rights most of the time. And also, I think it is necessary to educate boys as well about respecting women's choices and respecting their sexual choices. Then the other thing, to prevent it, as I told you, we need to make services available free of charge. Even a person living in furthest corner of the country should have access to proper contraceptive method, appropriate contraceptive method according to the age and her physical conditions.
Thank you for the great explanations, ma'am. What a wonderful and a productive discussion we had with you, Doctor. I'm pretty sure that our view learners are now well aware of abortion and its aspects. So, Doctor, thank you again very much. And we are so much grateful to you for sacrificing a valuable time on behalf of your busy schedules and even accepting our invitation in such a short notice. So we sincerely hope you to continue to aspire the community for a long time as a doctor, a lecturer, and even as a friendly, humble individual.
Thank you very much. And I wish you all the best for your future careers. And thank you for inviting me.
Thank you so much, ma'am. All right. With this, we are concluding the first episode of Detect and Correct Foliostick year 2022-23. Hope you have gained good knowledge about the topic we have discussed today, abortion and its related matters. So feel free to leave your comments for a better improvement of our interview series. Until we meet with another interesting episode of Detect and Correct, stay safe and goodbye.